everyone. Within fewer minutes, we would start this webinar. I hope everyone joins us as soon as possible. Those who have joined, it's a pleasure having you over here. And those who couldn't, kindly requesting them if they are connected to join them, or their friends and colleagues can ask them to immediately join us. Thank you so much. Start. Hello, Namaskar, and a very warm welcome to all for Thank a Dot, a breast cancer awareness initiative by SBI Life webinar. Hope you all are doing well, and I am Ridhima Brahmbhatt, your host for this webinar. And today we all have gathered here to discuss a very important topic around self help and to raise awareness around breast cancer. How many us really know everything about this deadly disease and ways to curb the same? And according to various reports, breast cancer cases in India accounts for 14% of all cancers in India. And amongst 1 out of 29 women is likely to develop breast cancer lumps in their lifetime, which is absolutely true. Considering these facts, it is really important to be educated and prepared for this deadly disease. So today, SBI Life Insurance has organized this awareness webinar, and I would like to thank Dr. Vikas Gupta for taking out time and being here with us to touch upon the important information related to breast cancer and help all of us learn a life-saving skill. Before we start the webinar, I would like you all to know that SBI Life Insurance is one of the most trusted private life insurance company in India and has launched a unique initiative called Thanks a Dot to raise awareness around the importance of self breast examination and ways to fight against breast cancer. This unique initiative will help in educating maximum across the country and aim to make self-examination a regular habit in women. I would request Mr. Vikas Gupta to enlighten us on the topic of breast cancer. Also, I request each of us who are present here to please put their doubts in Q&A session below, and Dr. Vikas will definitely answer few of them by the end of this session. Now I request Dr. Vikas to kindly take over the screen for the presentation.
Thank you so much, Ridhima, for such a warm introduction. I'm Dr. Vikas Gupta. I'm currently assistant professor in MJ Medical College, Navi Mumbai. I did my training in oncology, and thereafter I did my fellowship in GI and HB oncology from Tata Memorial Hospital, Mumbai. I am a European board qualified surgical oncologist. Um, Thereafter, I also did my fellowships in USA and Japan. And it's a great honor to be in front of you all to discuss a very important topic, that is breast cancer awareness. As we all know, the month of October is Breast Cancer Awareness Month, and it is important that all of us are aware about breast cancer so as to curb this deadly disease, the numbers of which are increasing each year. So as we move forward, we'll discuss about various aspects of breast cancer. We start with what is the current scenario about breast cancer, how much is the burden of breast cancer in Indian people. We move to the risk factors of breast cancer, the etiology of breast cancer. We thereafter come to the various symptoms and signs of breast cancer. Thereafter, we'll touch upon what are the various treatment modalities available of breast cancer. And lastly, we also discuss about what are the different ways in which we can prevent or make ourselves aware about breast cancer. And lastly, we'll also discuss about this Thanks a Dot program or the initiative which will help us in detecting breast lumps early. We move on to the next slide, please. As we can see by the numbers, breast cancer is among the most common cancers in India, and it accounts to about 27% of all cancers in women, and is by far the most common cancer diagnosed in both men and women combined. More importantly, the mortality due to breast cancer is increased, and it is around 1.6 to 1.7 times higher than what you see is the maternal mortality. If you see maternal mortality as a baseline, the number of deaths due to breast cancer is around 1.6 to 1.7 times higher. Overall, as Mrs. Ridhima said, one in every 28 women is likely to develop breast cancer in long term throughout their lifetime. And amongst the states, if you see, Kerala, Tamil Nadu, and Delhi have the most highest amounts of breast cancer diagnosed. Next slide, please. Why should we diagnose it early? It's very important that whenever one has breast cancer, it is diagnosed early, because if it is diagnosed late, in the later stages, the survival decreases significantly and may be as low as 3 to 17 times worse than when it was diagnosed in an early stage. Not only that, if you see the cost of treatment also increases significantly, maybe two times or double than as it is as much as it is diagnosed in an early stage. In 2017, India had the highest mortality rates globally from breast cancer, as you can see in that bar diagram. And if you see the number of cases diagnosed each year, around 2,000 new women are diagnosed each year with breast cancer. Next slide, please. So in short, every 4 minutes, that is every 4 minutes, an Indian woman is diagnosed with breast cancer. And if you see over a period of year, we have around 4.5 lakh deaths from breast cancer happening. So it is alarming statistics, and that is why it is important that we are aware about it. Sorry, next slide, please. So why do we diagnose breast cancer? So it's difficult to diagnose because it is neglected by many women. 50% of women avoid breast health related issues due to busy lifestyle, and 80% of women didn't feel like there's a necessity for routine examination. Sorry. Next slide, please. So what are the risk factors for breast cancer? The first and most important is age. As age increases, the number of women having breast cancer also increases, and age is an important risk factor for developing breast cancer. Just can you give me 2 minutes? I'll just have water. I'm having some sore throat. 2 minutes.
As in India, we do have many reasons for having breast cancer. The first reason is that negligence of self-awareness and negligence of knowing oneself. As a woman, this initiative is really great. What SBI Life is doing for the women, I'm really glad that they have came up with this initiative. Importantly, being a woman, even I know sometimes how careless we do become and not give the priority of knowing ourselves better. So, which is really important these days because of the first reason is schedule, the time that women doesn't have, whether it's maintaining or taking care of their family, their relatives, their children, their in-laws, whatsoever it is. A reason can be anything. Reason, there are X number of reasons for a woman of not taking the priority of taking her care of herself. But now it is a priority ahead of everything for a woman to take care. Handing over once again the session to Mr. Vikas. Kindly take forward.
Yeah, I'm so sorry for the interruption. Thank you, Ridhima, for
Absolutely
taking
fair
over.
enough, sir.
Thank you for
No
taking
worries.
over. So we were on the risk factors for breast cancer. As we know, age is an important risk factor because breast cancer per se occurs more commonly in above 50 years of age. So as your age increases, the risk of you developing breast cancer also increases, and that is why age is an important risk factor. Besides that, genetic factors are also very important. Why? Around 15% of breast cancers are genetic, that is, they are transferred from your family. So in your family, if your mother, your sister, your mother's mother or mother's sister are affected by breast cancers, the chances of you developing breast cancer also increases. More so if breast cancer happened in an early age in your siblings, in your mother, or in your maternal side. So very important is age, very important is your family history and genetic causes. There are a number of genetic genes in our body which are transmitted from family to family, and these genes are important markers of breast cancer. The most common and the most known marker is BRCA, which we call as BRCA. It is an important marker of breast cancer. If it is present in your family, the risk of you developing breast cancer is higher. Um, the other risk factors are overweight. Essentially, it has been seen that women who are more obese or who have a higher weight have an increased risk of developing breast cancer in longer period of time. Besides that, consumption of alcohol, obviously not social drinking, but consumption of alcohol on a regular basis has also been shown to be a very important risk factor for developing breast cancer in long term. Reproductive history is important. Why I say so? Because it has been seen that ladies who have an early menarche, that is, they start their menstrual cycle pretty early, within less than 13 years of age group, or who have a late menopause, that is the end of their menstrual periods happen after 50 years of age. These ladies also have slightly higher risk of developing breast cancer. Besides that, ladies who are nulliparous, that is, who do not give birth to any child, and ladies who give birth to child later, that is after 30 years of age, they are also slightly increased risk of developing breast cancer. Thirdly, ladies who do not breastfeed their child for at least 6 months, or do not breastfeed their child, they are also shown to have a higher risk of breast cancer. So all this I have been shown in studies to have a slightly higher risk of developing breast cancer, and probably these ladies need to look very carefully on their breast throughout their age. Uh, Lastly, obviously, ladies who have a prior diagnosis of breast cancer, that is, who have undergone treatment for breast cancer in one of their breast, or have undergone multiple biopsies for some lumps in their breast, they should also be very careful about their breast, because in long term they may probably have a higher risk of developing breast cancer. So overall, these are all the risk factors of breast cancer. So as you can see, some of these are modifiable risk factors, some of these are non-modifiable. So something like your age, your genetic makeup, your family history is not modifiable. You cannot do anything about it. If it is there, it you are at high risk of developing breast cancer. Whereas others like your weight, alcohol consumption, smoking are few or your history of your childbirth and all. Those are all modifiable risk factors. That is, you can modify them to reduce your risk of developing breast cancer. Next slide, please. So when we look at these risk factors, we know that these are the risk factors for breast cancer. So we should also know how can you reduce your risk of developing breast cancer. So there are certain things which one can do so that they reduce the risk of breast cancer. As we know, smoking and alcohol consumption are an important risk factor for developing breast cancer. So obviously you should not smoke. Smoking is one of the important causes of developing cancers, not only breast but many other cancers. So smoking should be avoided. Alcohol consumption should all be limited. You should not have consumption of alcohol on a regular basis. It is also injurious to your health, and obviously not only breast cancer but many other cancers. Besides that, control your weight, be physically active. You should do regular exercises. At least 30 minutes of exercises each day is what is recommended to have a good health and to reduce the risk of breast cancer. Having healthy food with more fruits and vegetables, having high protein and vitamins in them is important. And as I said, breastfeeding your child also is one of the important things which reduces your chances of developing breast cancer. Next slide, please. Coming to, we have finished about risk factors and prevention. Now we look into the signs of breast cancer, that is things which you should see yourselves in your breast and should be alarmed about it. Now, any change in your skin texture, that is any irregularity of your skin is alarming. Nipple discharge, more so a reddish discharge, is also alarming of a breast cancer. if if you notice any dimpling of your skin surface, any puckering or any dimpling of the skin surface, you should consult your doctor. Besides that, any enlargement in your armpit, which are called as nodes, are an indirect sign that there may be something cancerous inside. Any type of retraction of your nipple area inside, or any change in your skin color over the surface, is also one of the signs. But the most important sign is any swelling. So if you notice any lump in your breast, is a very important sign of breast cancer. So, as I mentioned, swelling is an important sign of breast cancer, but one should realize that swellings can be due to multiple causes. In a younger age group, less than 40 years of age, the most common cause of swelling is probably a non cancerous or a benign cause. So, swelling due to fatty lesions in the breast can appear at younger age group, less than 40 years of age, which is not to be worried about, because those are normal swellings of your breast which often regress after some time. The most common benign or non-cancerous swelling in the breast can be a fibroadenoma, which is a lump due to fatty content, or it can be due to fibroadenosis, in which there are multiple small lumps felt in your breast, which often increase or decrease depending upon your menstrual cycle. And often these are painful. So one of the important things is breast lump is often a painless lump. That is, there is no pain associated with initially, although pain can occur as the lump becomes bigger and it stretches your skin tissue. So these are all your signs of breast cancer. Next slide, please. So coming to what we want to know and what we are interested in is today breast self-examination. So how do you do this breast self-examination? So on a fixed day in your month, that is preferably after your menses have ended, in your second week of your menstrual cycle, that is what when it's the ideal period to do breast self-examination. For this, the lady has to first stand in front of the mirror, and facing the mirror, she has to see both her breast. She has to see the symmetry of the breast, whether one of the breast is going up or down or is asymmetrical to the opposite breast. This has to be done with your hands raised up, hands by the side, hands pressed against the waist, and also in bending forward position. So the first part is only inspection of your breast tissue to look for any changes in the appearance of the breast. Thereafter, with your fingers, your pulp of your fingertips, you have to palpate the entire breast. Gently, you can palpate either in a circular pattern starting from inside going outside, in a wedge shape pattern up and below, or in a zigzag manner so that you cover the entire breast. So there are two components of your breast self-examination. One is the inspection of your breast, of both the breasts standing in front of the mirror. And the second part of it is palpation yourselves of both your breast at the same time, so that to look into any asymmetry or any lumps that you feel in your breast tissue. Next slide, please. So breast self-examination is done by the lady herself, as I said, in a fixed time or during the month, or a fixed day during a month, and that is when you realize what is the problem in your breast. So you can do it facing the mirror in your house, or more commonly you can do it while having a bath. When you stand in front of the mirror in your washroom and have your bath, that time also it is better to appreciate any changes in the breast tissue, any lumps noticed in the breast. So this is about breast self-examination. The second part is clinical breast examination. Now, the clinical breast examination is done by the doctor. So, when you visit a doctor and are concerned about your breast, then the doctor examines you, and that is what it's called as a clinical breast examination. Next slide, please. So, what is the difference between both these two terms? Breast self examination is done by the lady herself each month, a fixed day in each month, starting from around 25 to 30 years of age group and continue to around 75 years of age group. Whereas a clinical breast examination is performed by the doctor on the lady when the lady visits the doctor concerned about her breast or just for a normal routine checkup. Next slide, please. And what does the doctor do when you visit the doctor? Doctor takes a very careful history regarding your any family history of cancer. He also inspects your breast tissue, and then he palpates both your breast armpits so as to check for any lumps in the breast. And at the same time, he educates you regarding what are the possible lumps that you can feel in your breast and for which you should be alarmed about. Next slide, please. So we have learned about breast self-examination and clinical breast examination. Along with clinical breast examination, the doctor may sometimes advise you what is called as a mammogram. Now, a mammogram, what is mammogram? Mammogram is nothing but is an X-ray, but it is a special type of X-ray which is performed for your breast. We nowadays recommend routinely screening for breast cancer. The screening for breast cancer involves doing a mammogram every 2 years, starting from around 50 years of age group and doing until 75 years of age group. For ladies who are more prone for developing breast cancer due to multiple factors like family history, they can start screening much early, probably at 40 years of age group also. Sorry. So once the doctor advises you mammogram, the technician does the mammogram in which your breast is compressed between two plates, and what you obtain is an X-ray, as is shown on the right side of the chart. And depending upon the look of the X-ray or the look of the lump in the X-ray, you can make out whether the X-ray is a normal X-ray, a benign X-ray, or it has something cancerous signs in it. So this is how mammogram is done, and mammogram is a very important part of your investigation to know about breast cancer. And if you do a screening mammogram as a part of your screening for cancers, you can diagnose breast cancer much early before even you can have any symptoms of breast cancer. Next slide, please. So coming to then, what do we want to see in treatment about breast cancer? So there are multiple ways of knowing about breast cancer and then treating the breast cancer. The modalities for treatment of breast cancer may range right from surgery is the most important modality. Besides that, you have chemotherapy, which is the medication for breast cancer, and lastly is the radiation therapy, which is nothing but special X-rays which are used for curing breast cancer. Next slide, please. So whenever someone comes with a diagnosis of breast cancer, we advise them surgery for breast cancer. The surgery for breast cancer essentially involves removing the cancerous tissue from the breast. The surgery may involve removing only the tumor from the breast, that is called as lumpectomy, or it may involve removal of entire breast on that side, which is called as mastectomy. So in lumpectomy, you remove only the tumor in the breast, and you don't remove the entire breast, and also you remove nodes from your armpit area. And then in mastectomy, you have to remove the entire breast. So depending upon the size of the tumor, size of your breast, the doctor will advise you to undergo either of these procedures, either a lumpectomy or a mastectomy. So this is briefly a basics about the surgery of breast cancer. Nowadays, there are multiple new modalities available for even for surgery for breast cancer, in which we can decrease the size of the tumor and then offer the patient what is called as a breast conserving surgery, in which we try to conserve the breast and only remove the cancerous part in the breast. Next slide, please. And obviously chemotherapy and surgery are complementary to each other. So after you have finished your surgery, the doctor will advise you to undergo chemotherapy. Now what is chemotherapy for you? Chemotherapy is nothing but injections which are given through your normal IV line, which is put in your hand, and through that we give continuous infusion of chemotherapy drugs to your body. These chemotherapy drugs may have few side effects initially, but more importantly, these are very important to tackle small microscopic spread of cancer which may happen throughout your body. So whenever we do surgery for a patient, depending upon the report which comes of the tumor, we may advise patient to undergo chemotherapy. The treatment of chemotherapy may vary from 4 months to 6 months to sometimes 8 months also, depending upon the type of injection and type of chemotherapy which is given to the lady. Next slide, please. The third modality which we discuss is radiation therapy. Radiation is nothing but special X-rays which are focused on your breast tissue, and this X-rays in turn kill the tumor which is present inside the breast. So these X-rays act on the tumor and kill the cancerous tissue. The treatment of radiation may also vary, and it may be around around 1.5 to 2 months sometimes, in which the lady has to go every day 5 days in a week and take this radiation therapy. So this radiation therapy is given after surgery is completed. So surgery is the most important part of your treatment, and this is followed by chemotherapy and radiation therapy. Next slide, please. And most important, whenever you go to a doctor with complaints of breast cancer, the doctor will examine you, and if he has any suspicion about breast cancer, he will advise removal of the sample from the tumor to confirm breast cancer, which is called as needle testing. In this, a needle is inserted in your breast tissue and sample is removed. This sample is then sent for examination. Only after we have confirmation of cancer on this examination, then only we can say that probably you have breast cancer, and then if you require treatment for breast cancer. Next slide, please. So I'll just quickly go through what we have discussed about till now. We have discussed about breast self-examination, in which I told you have to examine your breast, inspection of the breast in front of the mirror, and afterwards followed by palpation of your breast to look for any changes in the breast tissue. We discuss about symptoms of breast cancer. That is different warning signs of breast cancer, which are very important, and which make you realize about breast cancer much early to consult your doctor. We discuss about diagnosis of breast cancer, that is different modalities available. We discussed about mammogram. We discussed about tissue testing for breast cancer, and we discussed about biopsy, that is removal of tissue or the sample from the breast for confirmation of diagnosis. We also discuss about treatments of breast cancer available, which may be in the form of surgery, most important, either removal of lump alone or removal of entire breast, followed by chemotherapy or followed by radiation therapy. Next slide, please. What are the take-home messages that we have, that we know of? The most important for any lady is know your risk. We have discussed about different risks of breast cancer. So you should assess yourself, what risk factors do you have amongst all those which we have mentioned. If you have any of those risk factors, you have to be more concerned about your breast cancer. And then this screening examination and breast self-examination become very important. We have to undergo regular screening for breast cancer, not only for you, but even for your family members. As I said, mammogram is a very important tool for screening, and it is a simple X-ray which is done, and it gets over in around 15 minutes, and you can go home. So this is recommended worldwide to be done every year in few countries, or every 2 years, starting from 50 years of age group up till 75 years of age group. And if you have any of the risk factors, to start with mammogram testing much earlier. Third, you have to take a prompt medical attention. Do not ignore any signs of lump in your breast. But at the same time, don't be alarmed for all the lumps. As I said, in younger age group, less than 40 years of age, maximum lumps are benign lumps, that is non-cancerous lumps, which automatically disappear or which do not cause any harm to you and can be removed. But any lump after 50 years of age group is very suspicious, and all these ladies should take prompt attention to it and should consult your physician or doctor for any required investigation. You also should encourage your family members to get screened for any type of breast cancer and any type of symptoms that may occur due to breast cancer. Next slide, please. We just, as we know, this excellent initiative by the Thanks team and SBI Life, in which, as everyone has those kits which have been given, which is a Thanks kit, and if you open the kit, if you can open the kit, next slide, please. Yeah. So this is what the kit looks like. The photo of the kit in front of you, and if you can see the page on it, if you can open it, you can see there are three small lumps or swellings or small attachments seen on that on that cardboard, and this is to make you realize that how the lumps feel in your breast. So if you gently palpate, if if everyone has the kits in their hand, and if you can remove the kit and remove that cardboard, that card sheet from the kit, and try to move your fingers over the pulp of your fingers over the over the kit, you can feel these three small lumps or dots on the kit, which make you realize that how you may feel the lumps in your breast. This is just it is just like for comparison purposes to make you realize that this is how the lumps or the swellings feel in your breast when you try to palpate it. Next slide, please. As I've already discussed about breast self examination. So what you have to do is very simple. Each fixed days in the month, you remove the kit. You feel the kit surface to just have an idea about the lumps or the swellings that you can that is felt, and then you go in front of the mirror and then yourselves palpate your both the breast. So this is just to make you realize that probably this lumps which you now feel in your breast, if you have it, they are suspicious, and then you have to consult your doctor. Next slide, please. And the most important part and the most very important thing about this kit is what you can do is there is a number, as you can see, 8860780000. So it is a very simple thing. You just have to WhatsApp on this number. This automatically then fixes the date when you have to do breast self examination, and it sends you a reminder on WhatsApp that this is the day when you have to do this breast self examination. So very importantly, very nicely shown in this step by step fashion. You stick the card to a very accessible area, probably somewhere in front of the mirror, and then you move your fingers over the placard on the kit, trying to feel what are the dots, and you have a reminder set on your mobile, so we will get a reminder on that particular day of the month. And once you get the message, you then do self examination of your breast in front of the mirror, so that you are aware that how it if there are any suspicious lumps in your breast, and you take this opportunity to tell your friends and relatives also about what this is, and if they require the kit, they can obviously get it through SBI Life. So I think this is a very important initiative, and a very small thing, but I think will probably make a very huge difference in ladies who follow it very meticulously. Next slide, please. So I think with this we end our presentation. You have my email ID and phone number. In case you have any doubts and you have to contact me, most welcome to mail or WhatsApp me so that I can answer your queries. I think I'll hand over to Ridhima just to look if there are any questions which I can answer.
Surely. Thank you so much, Doctor. Well, let's check it up. Is there any questions? All right, so right now we do not have, but from my side, I do have one question. If I seek the permission to read this question, so can I, Dr. Sab?
Sorry, I didn't get you. Sorry, your voice was just not. Yeah.
So I have a question from
Yes.
my end.
Yeah,
We
yeah.
do not have any question into our Q&A
Session. Okay,
box.
okay. Well, yeah,
So though we had already opened session, we are people to share us the questions.
yeah, yeah. That we
By
can
then,
answer
I
as well.
have one question with
Yeah,
me.
yeah. Please, please.
Great. So, okay. So the question is that as you have mentioned that a person should know their family history. Okay. So a woman should know her family history. It might be possible for the till the fourth generation. They do not have the signs. In fact, they do not have any of the chances to have the breast cancer, or they don't know probably. But are there reasons, or are there situations or chances of getting breast cancer to the fifth generation by any means if there is no ever family history of that woman of having the breast cancer?
Yeah, so as I said, a very important question. And as I said, see, breast cancer family history is only seen in 15% of the patient. So only in 15% of
Okay,
patient there will be a family history that there was breast cancer in the family before. In rest
got it.
80% of the patients, there is no family history. So you may be an
Okay.
index case. You may be the first case in the family who probably may have the genetic mutation because of which you have developed
Hmm.
breast cancer, or you may be having breast cancer due to non-genetic causes also. So in younger age group, many times nowadays doctors are advising ladies to undergo genetic testing to know whether you are the first case in the family to have that genetic mutation because of which you have developed breast cancer in such a younger age group. So nowadays there is much more awareness, and many doctors are now telling their patients to undergo genetic testing if they develop breast cancer in a younger age group. So this is how you know that probably there is some familial cause of you developing breast cancer.
Great. So, Dr. Vikas, we do have two questions over here.
Yeah,
The first question is you have to again share your email ID once again. And the
yeah, yeah.
second question is at what age women generally detect breast cancer?
Yeah, so as I mentioned, age is one of the risk factors of breast cancer. So most commonly in 80% of the patients, the breast cancer occurs after 50 years of age group. So between 50 to 75 years is the prime age wherein ladies may develop breast cancer, and they have to be very much sensitized about it in this particular age group that there's a high risk that they may develop breast cancer if there is any lump in the breast. So obviously the lumps should be there in the breast for them to be worried about in this particular age group. And in that age group, breast self-examination and your clinical examination by your doctor becomes very important.
And we also have one more question, and that is how regularly can you perform breast self examination?
Yeah. So breast self-examination has to be done each month. So 12 times in a year. So each month the lady has to do breast self-examination. You start doing breast self-examination as early as 40 years of age, after 40 years of your age, and continue doing it till around 65, 70 to 75 years of age group. So it is obviously it is not very difficult. You can do it while having your bath in the morning. That's the most convenient time because anyways you're going in the washroom and you're removing your clothes. So that time only in front of the mirror you check the breast, and the most important is people forget about it because they don't forget key today you have to do it. So in in this particular scenario, this particular thanks a dot card and the reminder is very important because it sends you a WhatsApp reminder that this is the day and today you have to do the breast self examination. So you are aware that today you have to do it, and then probably you can do it that time in the month. So I think this helps out in reminding the ladies, and has to be done each month for that particular age group.
And let's take up one more question, and that is how can you understand your stage of breast cancer?
So just to be very brief about it, there are four stages of breast cancer: one, two, three, and four. One is the earliest stage, and four is the most advanced stage. So first stage is the earliest stage of breast cancer, in which if you diagnose your breast cancer in this stage, then it is called as the early breast cancer. The stage depends upon the size of your lump in your breast. So if lumps are less than 5 centimeters or less than 2 centimeters, that is when you say they are in the early stage. Or when they have not spread from your breast to your armpit area, then you say they are in the early part of your breast cancer. So stage 1 and 2 is preferably what is called as an early breast cancer, or in the early early part of your breast cancer progression.
So last question we are taking up for this session is, what should we do when we detect signs of lumps?
Sorry, I could not get the last part of your question. Can you please repeat it?
So as earlier you have mentioned
Uh, I actually, uh, I actually could not get your voice. I do. Probably there's some error. Do you want to ask how does breast cancer depend on genetic factors?
So the question was, what should we do when we
We
detect
detect
signs of
signs of
lumps?
lumps. Yeah. So see, if you have, if you
What should we do when we
when we do
detect?
click signs.
Am
Yeah,
I audible right now? No, no. So the question was, what should we detect signs of lumps? Yes.
yeah, yeah. So I saw it just now. So so obviously, if you have any signs of lump in your breast, first of all, don't be alarmed. It is not that this is only breast cancer. As I told you, there are multiple causes of your lumps in the breast, most of in a younger age group. So if you have any signs or any lumps in the breast, do consult your doctor. Go to your doctor, tell them that think that there is some lump in the breast. Let the doctor examine the breast. When the doctor examines your breast, he gets an idea that it is looking more like a cancerous lump or it is a non-cancerous lump. Depending upon what your doctor thinks it is a cancerous lump or a non-cancerous lump, he may advise you to undergo either ultrasound or a mammogram of the breast. And also, he may advise you to undergo the needle testing from the breast to remove the small samples from their lump and send it for evaluation to further confirm the diagnosis of breast cancer.
Okay, great. So hereby we have taken up many of the questions, and still questions are popping up because of restriction of time. But yes, definitely, I would like to mention one thing which is really important, that in this case of breast cancer, we do have Dr. Vikas Gupta for our assistance. Moreover, being a woman, you should always be aware of yourself, definitely, and that's more important. Priority, I would say that's the basic priority of everything ahead. And thank you so much, firstly, Dr. Gupta, for doing this session with us. It was indeed a very detailed information about breast cancer, and a very good initiative by SBI Life Insurance. Also, I hope now you all have understood the self-examination process, and you all can perform it now by yourself every month. Also, Dr. Vikas Gupta has already mentioned about the QR code. I'm again repeating that scan the QR code or say hi on 8860780000. I repeat, 8860780000, and set a monthly reminders. All the women, this is especially for all of you, to please do this and make it a priority. And for more details on this, on thanks a dot, you can kindly visit on www.sbilife.co.on hyphen thanks a dot. Also, you all will get the self-examination kits, and it will be shortly available on the micro site to order, and you all can benefit and take care of your health by that. And before leaving, once again, Dr. Saab, it was a request by somebody to share your email ID, and once again, I have received the
Yeah, I
same
think
question.
they can just send. They can just see the last part of my PowerPoint. It has the email ID.
Yes, yes,
So,
yes.
or
So
I'll answer it to everyone also over there.
yes, do the needful to them, those who are seeking the concern about if
Yeah, yeah.
how to proceed to the person, or if there is a person who has the signs of breast cancer, to whom to consult. So these are the very basic need that a woman had. So I request you to kindly proceed with your email ID. And by this, today's webinar, we have came to an end of this webinar. And yes, it was indeed a wonderful, wonderful webinar, all for us, for being a woman, yes, for us, definitely. It was so much required at this during these period of time, when these century itself, I would say, not during this period of time. Each and every woman is so busy in taking care of their family, friends, relatives, in-laws, and not looking behind that they also need care to look upon themselves. And this is how the ratio of breast cancer is increasing day by day. And as SBI Life Insurance have put up such a great thought and initiative, thank a dot initiative, which is giving you, actually doing your helping each woman to make her a priority every month by putting up a date on the calendar that I need to examine myself, which is really important. So all thanks to entire SBI Life team for taking this initiative. Thank you so much once again, giving your time and doing us the space and making us aware, every woman aware about this deadly disease, which can be cured on a very early stage, if I'm not wrong. And once again, SBI Life, don't forget to scan the QR code. It is really, really important for all of us, and you'll shortly receive that gift from the microsite. Thank you so much, all. Had a great pleasure and time. Thank you, Dr. Vikas Gupta. Thank you, entire
everyone.
team of
Thank
SBI
you,
Life. And thanks a lot. Thanks a lot. Have a nice day.
Thank you, everyone. Yes.